right, let's dive in. We've got a lot of ground to cover today. So welcome everybody to today's webcast, Vaccinations in the Workplace, Top Questions Employers Are Asking. We have members from AFTO on the line today, and we're very pleased to be doing this once again in partnership with our colleagues from the Alliance for Healthier Communities, the Nurse Practitioner-Led Clinic Association, and also our Indigenous Primary Healthcare Council. Always great to have a strong partnership with other provincial associations and do these jointly. The topics covered today, everyone on the line will appreciate everyone in primary care, so we thought it was pertinent to do this jointly with our colleagues. I'm just going to go over housekeeping very quickly today, and as I said, we do have a lot of ground to cover, so I won't spend too much time on this. I think everybody's familiar with Zoom at this point. It's been dictating our lives for the past year and a half or so. We're going to keep you all unmuted. As I've mentioned, we have close to 200 registrants on today's call, so we'll keep you all unmuted. You can raise your hand if you want to ask a question, but better yet, we'll ask you to submit your questions in the QA section on the Zoom. We did ask everyone to pre-submit their questions as they registered for the webinar, and we have sent all of those questions to Maria. There was well over 100 of them, so she's going to do her best today to get through them all. Whatever we don't get through today, we will send up in a follow-up email. So as you're listening, feel free to send your questions, but just keep in mind that Maria's got a lot of slides to cover and she probably will get to it or answer it. So just be patient as we get through the slides today. The webcast will be recorded and we will send out the recording along with handouts that Maria has provided today. We aim to do that within about 24 hours of the webcast. So we'll look for that in your inboxes tomorrow. After we'll send it out directly to our members, and then we will share that as well with our partner associations that are on the line today to then share with their members. So again, just be patient. You should receive that by end of day tomorrow. So with that, I'm happy to introduce our speaker today, Maria McDonald from HR Law. I think we're all familiar with Maria now. This has been, she's done a handful of webcasts for us over the course of COVID. She's I like to call her our personal guru in employment law for healthcare. She has a tremendous amount of expertise. So we are very pleased to have her speak with us today about vaccinations in the workplace. So with that, Maria, I will turn it over to you to dive in.
Okay. All right, thank you very much for having me. I am going to dive right in. We're going to, because there's a lot to cover. So the first thing I want to address is what law or laws cover vaccinations? Because people are like, am I allowed to do this? Does the Human Rights Code allow me to do this? Or ESA, or I've had the Geneva Convention thrown at me. So let's settle the law, let's get you some understanding on what these laws mean with respect to vaccinations. The Human Rights Code only applies if the person has a disability or a medical exemption or a religious exemption. It doesn't say anything about whether you can collect information. It's not going to affect whether you can test, because there's no serious repercussions about testing. It might have something to say if you require people to be vaccinated and they have a medical or religious exemption. We're going to talk about those exemptions. But if they do, if you require people to vaccinate and they have a medical or religious exemption that's been approved, then you've got to do the normal accommodation. We're going to talk about that. What does the ESA say about whether you can ask people for vaccinations, test, or get vaccinated? Nothing. It says nothing. Employment standards doesn't apply. The only thing employment standards does with respect to COVID is to say you get 3 days paid leave if you're sick for any reason related to COVID, and after that it's an unpaid leave. There's also a provision about whether somebody is laid off due to COVID, but nothing about vaccinations. What about the Occupational Health and Safety Act? Well, what that does say, it says nothing about whether you can collect information. It says nothing about testing or whether you can vaccinate. It says nothing about either of those three things. But it does say that as an employer, you have a legal obligation to take all reasonable measures to ensure the health and safety of your workforce. So as a lawyer, that is one of the things I would be relying on to say this employer has a right to ask for the information, impose testing, or impose vaccination, because that will protect the health and safety of their workers. So it doesn't prevent you from doing any of those things, and it's actually an argument for why you have to have various vaccination policies. Privacy legislation. Of course, that is only going to impact whether or not you can ask for the information and how you store it and how you collect it. So I've been getting a lot of letters from employers that they've received from their employees saying, this is against PIPEDA and the Municipal Information and Freedom and Protection Act and PHIPAA. Okay, so none of them, most of them don't apply. PHIPAA applies. It's personal health information, whether or not someone gets vaccinated. But there are no laws under PHIPAA that prevent you from asking for this information, i.e., are you vaccinated, if it's for an employment-related purpose. Just like you are totally allowed to ask somebody for a medical certificate if they are absent for work, or to have a medical questionnaire filled out if they are asking for a medical accommodation. So you are entitled as an employer to ask for this information, even though it's personal health information, because it is relevant to how you are going to operate your workplace. Now, caveat to this, and this is like any personal health information. If you are an employer and you have a physician or a healthcare worker, nurse practitioner, et cetera, that is doing the vaccinations or giving any other medical information or medical care to your employee, don't go to the healthcare practitioner for that information. Just like with a medical note, you should be going to the employee. You are wearing an employer and employee hat, not a physician or primary care hat. So any information, you can get it, but it has to come from the employee. The employee can give you consent to get it. I say stay away from that. Just have a practice. Employee, give me the information. The Charter of Rights will be argued only with respect to government action. It doesn't impact primary health care providers, okay? But the government of Canada, the provincial government, municipal governments, if they make laws, they can be challenged under Charter of Rights, but you can't. The common law or arbitration law. So common law is going to court, right? Arbitration law is if you're unionized, you don't go to court, you go to an arbitration. That will be relevant. It doesn't prevent you from asking for, are you vaccinated? I think that's pretty well standard. You can ask for it if it's for health and safety reasons, which it is. Whether you can test, that has already been decided in the arbitral law, in arbitrations. And there's two cases I mentioned. Yes, testing is okay. Right now we're in a pandemic. Testing is not perfect, but it's a tool in your toolbox, and yes, you can use it. It may also, the common law, so courts and arbitrations, may also play a part. They're not going to prevent you from having, civil courts. So if you're not unionized, let me backtrack. If you're not unionized, the civil courts, which is what your employees have to go to, are not going to prevent you from having a vaccination policy. Depending on the repercussions, i.e. if you terminate, et cetera, then there might be a legal dispute about whether you have to pay notice. We're going to get into that more. Arbitration law, if you're unionized and you have a policy and the union doesn't agree with it, they can actually go to an arbitration and argue that the policy should be struck down. But in a non-unionized environment, the employees cannot go to court and ask and have that struck down. They can only argue the penalties for not complying with it, i.e. termination, was too severe, etc. So that's just a quick overview of a lot of laws. Basically, nothing here is preventing non-unionized employers from having a vaccination policy. Arbitration, if you're unionized, that could be challenged. But there are there may be legal consequences depending what you do if an employee doesn't follow your policy. Okay, and we will touch on most of these again. Okay, so the other big question that we have is Directive Number 6 applicable to primary healthcare clinics? So what is Directive Number 6 for those of you who don't know? On August 17th, the Chief Medical Officer of Health of Ontario issued a Directive Number 6. You will get the directive in your handouts, and you will also get the Ministry of Health resource. It's a 10-page or so document explaining Directive Number 6. It is applicable to hospitals, home and community healthcare service providers, and ambulance services, either paramedics. It's very similar to Directive Number 3 for long-term care homes. It is also applicable to primary healthcare clinics if you are operating your business on a hospital site. Now, if you are actually in the hospital, then this Directive 6 applies. So they use the example in the resource center. If I have a coffee shop in a hospital, do I have to comply with the Directive Number 6? Yes, you have to comply with the hospital's vaccination policy under Directive Number 6. Yes. If somebody asks, my hospital is the head office, I think if you have a totally different separate site, you're not on the actual hospital site, I don't think they're really going to care. The issue is Directive Number 6 tells hospitals you have to have this certain vaccination policy, and everyone who's on your site working in the hospital has to have it too. So that's the issue. It is not applicable to primary healthcare providers if you are not operating on a hospital site. For now, the ministry is looking at whether or not Directive Number 6 will be applicable to primary healthcare clinics. As of today, that is not the case, but we could be going there. Okay, so now you know who it's applicable, and for most of you, it is not applicable to you. But it may be something that you want to consider. And a lot of this webinar, what I've done is I have drafted a policy, a vaccination policy that is based on Directive Number 6. I drafted that. I'm going to give it to you, and we're going to go through it. And it's a starting point. You might want to use it because I think Directive Number 6 is a good policy to have. It is not, okay, what is Directive Number 6? It is not a requirement to have mandatory vaccinations. It does not require the hospital to say everybody must be vaccinated or else, or get terminated, that's what we mean by mandatory vaccinations. You get vaccinated or you get terminated. Directive Number 6 says you must have a vaccination policy, and that policy is basically get vaccinated or get tested. That's the policy. And that's a minimum standard for all those organizations covered under Directive 6. So at a minimum, hospitals, I'll just use hospitals, must have a vaccinate or test policy. That's the minimum standard. But a lot of you know that some hospitals are saying, yeah, we tried that, it's not working. And so we are now going, you either get vaccinated or you get terminated. UHN, I haven't read their policy, but I've read about it. And they had a vaccinate or test policy for a couple of months now. And I believe after so they collected the data, who's vaccinated, and they had 900 staff that still weren't vaccinated, and they were testing them 2 or 3 times a week. That's 5,700 tests a week. And so I believe they have said, no, you've got to be vaccinated by October 8th. If you're not vaccinated by then, you get 2 weeks leave, unpaid. If to think about it, if at the end of those 2 weeks you are still not vaccinated or don't intend to, you'll be terminated. So directive number 6 doesn't say that, but some hospitals have decided to do that. And that is something a clinic can decide as well. So let's just talk about directive number 6 before we talk about the more stringent mandatory or vaccinate or terminate. So directive number 6, what that says is staff must choose between one of 3 options. The reason I'm going through this is because the policy I've developed for you is based on this. Staff, you must choose that you are proof of double vaccination. I've expanded that a little bit. Proof of medical exemption. I've expanded that because I think you also need to have choice of a religious exemption, which we'll talk about, or you complete an educational session. So basically, you're vaccinated, you have an exemption, or you take this educational session. Directive number 6 says organizations, if you want to drop that educational session, you are free to do so and only have 2 choices, vaccinate or have an exemption. You can drop the educational session. If you do drop it as a choice, you still have to offer it as a resource, but it's not a choice. So, and regardless of whether you have 2 options or 3, anyone who is unvaccinated, regardless of whether they have an exemption or it's personal choice, you have to be tested. So that's why it's called a vaccinate or test policy. And under directive number 6, I believe it's once every 7 days you have to be tested. So clinics, if you're not covered by directive number 6, do you have to have a COVID policy? I think the law is leaning towards yes, you do. It's not quite clear. Definitely the recommendation is you should have a COVID vaccine policy, especially if you haven't got 100% vaccination rate among your staff. Just so you know, this regulation came out on August 24th. It's Regulation 364. It's part of the Reopening Ontario Act. And it said in there that employers must comply with advice, recommendations, and instructions of the Office of the Medical Officer of Health regarding COVID vaccination policies. So basically, the government is saying, employers, if your public health unit has issued recommendations or advice about having a COVID vaccine policy and what's supposed to go in there, you're supposed to follow it. We're not sure if this has the force of law, but I think you're all here, so I'm thinking that most of you will want to have a vaccination policy. So what kind of policy can you implement? You should have a look at your public health unit, your regional public health unit recommendations. I think most all of them have issued, recommendations about employer COVID vaccination policies. I haven't read them all. They are different. I have read a couple of them. I looked at the Toronto Public Health Unit, and their recommendations are similar to Directive 6. You should have a policy that says vaccinate or test. I looked at the Peel Public Health Unit, and I think that doesn't have a policy, but a bit more general about what you can implement. And the Ottawa Public Health Unit, I thought was a little bit more strict than Directive 6, and didn't really require mandatory vaccination, but was kind of leaning there with this statement: testing is not an equivalent substitute for a complete series of a COVID-19 vaccine. So you can have a look at these. And if you think you are compelled to follow these directions. I'm not so sure. I think there's a lot of ambiguity and leniency about what you're supposed to do in these policies. But if you have specific questions, you can contact me and we can look at the PHU recommendations and how, if it jives with what you want to do or not. So what are your options? Bottom line, I think you are required to have a vaccine policy, but I think you have significant choice about what that policy is. And I basically think that you should be, the bottom line should really be a vaccinate or test. I think that is a best practice. Not sure it's the law, but I think it's definitely a best practice to, you can have a mandatory vaccination, which is you vaccinate or there are consequences up to and including termination. In my experience in the last month, I think most are going with the vaccinate or test, but I do know of some that are following the hospitals who have done mandatory vaccination, vaccinate or terminate. So I do know of some FITs that are going that route. Okay, so big question. Is mandatory vaccination, that is vaccinate or terminate, is it legal? Again, it's not the, if you are unionized and you bring this in, a union might challenge the policy and an arbitrator is going to decide if it's legal or not, and it can be struck down. I don't know of any law on that right now. If you are not unionized, a court is not going to strike it down. What they are going to look at are the consequences for somebody who refuses. So if somebody does not get vaccinated, you have a mandatory vaccination policy, and they say, I'm not getting vaccinated. Now, leave aside human rights exemptions. We'll discuss that later. They say, no, I don't believe in it. I'm too worried about it. I'm not getting vaccinated. Well, you could, so let's say one of your consequences are, okay, you have to go work from home, we'll pay you from home, or we're going to alter your work conditions, you can't see these patients, or we're going to put you on desk duty. If they agree to it, that's it, that's fine. If they don't, and they can claim constructive dismissal, so they can bring a lawsuit. And they can say this is unreasonable, and a court will have to decide whether it's reasonable or not. If it is reasonable, they lose. If it isn't reasonable, then it's basically a termination and you have to pay notice. You might say, if you don't get vaccinated, you're going to go on an unpaid leave of absence until at least, this fourth wave is over, or some undefined period of time. Again, they can sue for constructive dismissal, and a court will determine whether or not the unpaid leave of absence was reasonable. If the court says, yes, that was reasonable in this circumstance, then they're terminated and they don't get anything. If the court says, no, it really wasn't reasonable, she could have worked from home, or she could have worked in a back office, that was not reasonable, she's terminated, but you have to pay her money. Another consequence of mandatory vaccination is you terminate. And if you pay out the appropriate amount of notice, that's the end of it. If you don't pay out any notice or the appropriate amount of notice, then the employee can bring a wrongful dismissal action and sue for notice. And it will be up to the court to decide whether or not you should have paid any notice or if you should pay more. Can I tell you what a court will decide? Nope. Nobody can right now. We don't have any case law, and it is very fact dependent. Okay? It really depends on what the person does, specifically what the person does. So you're going to have to decide if you have a mandatory vaccination policy, and you've got and you're going to terminate. And let's say you've got a great contract and you can terminate and give them ESA minimum. That person's been there a year and it's like 1 week to terminate. You might say, yeah, I'll just pay the notice. And so I'll pay the 1 week. That's the end of the story. The person's been there for 15 years and has no contract. You're going to have to probably get legal advice on that termination, because if you have to pay notice, depending on the circumstances, it could be a lot of money. So you can do it, but there may be legal claims based on the repercussions for an employee not complying. Okay. So we're going to go through the vaccinate or test sample policy that I've prepared for you. You will get this policy tomorrow, but I have broken it down piece by piece to tell you what's in it and why, and this will answer some of your questions, hopefully, along the way. So it is handout 1A that you'll get tomorrow. It's not mandatory vaccination. It contains the 3 options. I'm vaccinated, I have an exemption, or I'm going to take the educational course. You can drop the educational course if you want. You should offer that as a resource, though, if you do drop it. For those who remain unvaccinated, this policy says you must do the rapid testing, and you may be subject to other IPAC controls or changes to working conditions. You may have to wear your mask long after we're not masking. You may have to wear full PPE, etc. It's a starter policy. You can use this in combination with your public health unit recommendations or the directive number 6 resource guide. That also has a sample policy in it. It's not as robust as mine. Okay, so any policy, you have a preamble, you have a purpose. The purpose of this policy is to protect clerical, admin, employees, full, part-time, and casual, should cover everyone, contractors, physicians, students, and volunteers, collectively referred to as staff, from acquiring COVID-19. You are going to have to decide who this applies to. You may not be able to apply it to physicians if you don't have authority over them. So obviously it should only apply to people you have authority over. This policy says you are strongly encouraged to receive a COVID vaccine, subject to human rights exemptions. In a mandatory policy, it would say all staff are required to receive a COVID-19 vaccine. That's the difference. This is an option. You're encouraged. The scope and general information, again, you want to set out who is covered by this policy. Under general information, you'll see in my policy, I've got, the blurb about why this is important and what the data is saying. That probably needs to be updated. I've done the best I can. You can change that. The general information, that's just your selling pitch, right? Of why you should get this, why it's safe, etc. So general information, definitely you can play around with that. And the scope, that has to fit your circumstances of who it covers. Okay, let's get right into the human rights exemption. There are 2. One is medical, the other is religion. We'll deal with medical first. This is going to be the stickiest one in terms of actually how to play this out. Let's read through what my policy says. Medical exemptions will require a written medical certificate from a physician or nurse practitioner. I've underlined physician or nurse practitioner. That's what's in Directive 6. I think you should stick with that. I don't think it should be a therapist, physiotherapist, counselor, psychologist, etc. This is medical. I think it should be nurse or nurse practitioner or physician. The medical certificate should advise that the physician, nurse practitioner has an independent and objective opinion. This is not in Directive 6. This is something I put in. This is something I use all the time in my requests for medical certificates. Why? Because I feel, look, I think nurse practitioners and physicians, I know they have a battle with people coming in all the time and telling the doctor or nurse practitioner what they want. And I understand we get medical certificates all the time saying this person is off sick for 2 weeks. I had one this summer. This person cannot wear a mask for medical reasons. Okay, I don't know when I get that. When I read that, I don't know if that's the physician writing what his patient has told him or what their objective opinion is. And in a situation like this, I need their independent and objective opinion. So I ask, is this your independent and objective opinion? And in that situation, for example, I did about the mask, and I haven't heard back yet. Physicians' notes can change when you ask for the independent and objective opinion. So I ask for it. So we're asking for your independent and objective opinion that the staff member cannot receive or must delay the COVID-19 vaccination. They might be getting certain treatment right now, which makes them vulnerable to it, so it may be delayed due to a medical contraindication. Okay, and I added this next part. I gotta be quite honest, I'm not even sure I would put this in. I'm putting it in for you to think about. I put this in, I said, that your opinion is in accordance with the most recent publication from the Ontario MOH's publication, COVID-19 Vaccination Recommendations for Special Populations. The MOH has the longest titles to some of their documents. But basically, this document sets out who should or should not get a vaccine. And it deals with people with allergies or I can't remember the heart condition, the myocarditis or something, sorry, or people undergoing like chemotherapy, etc. So I thought, maybe we need to put in something that is objective and standard and said, it's your independent opinion, and it's in line with the most recent information on this. This is not the law. This is a recommendation or a suggestion that you can use. We also say the medical certificate must set out the effective time period for the medical exemption, because not all of them are forever. Handout number 3, is this Ministry of Health publication on vaccination recommendations for special populations. It's updated to today, August 20th. That was the latest I could find. So I put this right in the policy. This is, if you're looking for a medical exemption, this is what you have to ask for. Now, you may not get this in a medical exemption. You might just get a form that says, Mary can't get the vaccine for medical reasons. So if that's the case, if it doesn't meet the qualifications you've got in the policy, then I recommend you send a medical questionnaire to the physician. Actually, and the way you do this, so the medical questionnaire will ask more specific questions about why the person can't get a vaccine. We're going to deal with those specific questions in a minute. But if you are going to get a medical questionnaire process, give it to your employee gives it to the physician fills it out, physician gives it to the employee gives it to you. Don't cut out the employee and go right to the physician, please. Even if the physician is in your clinic, don't do that. Wear your employer hat. I like medical questionnaires because it forces the person filling them out to look at the circumstances. So I like saying, look, this staff member is heading up a clinic of elderly people with diabetes and sees them on a daily basis, right? So it puts, it colors in why you want this person to be vaccinated. So I often like to put that as a background information. And then in the types of questions, so, you'd say, we understand the person is saying they can't get a vaccination. Is this your objective opinion? Which is what I've got in my policy. You can refer to the MOH publication on special populations or something else and attach it. Again, that would accord with what I've got in the policy. But I've heard other people say, no, I'm going to go further than that. I'm going to list all the medical reasons for the possible reasons for a medical exemption that are recognized by science. Allergies to the mRNA or the the heart condition or they're undergoing treatment, and ask if it's for one of these reasons. You could do that. I've heard others say, I'm going to ask for the reason. Why can't this person get the vaccine? We're usually not supposed to ask for a diagnosis. I'm not sure that is a diagnosis. It's kind of a general reason why they can't get it. I'm not sure how the HRTO will look at this, but I'm not saying you can run out and do it. I think you should get advice on it, but I'm not so sure it would be against, it would be a violation of the Human Rights Code to ask for a general reason why they can't get it. You could also ask the staff if they've, ask if the staff member has seen a specialist to determine if or when he or she can be vaccinated. I know the MOH publication on special populations does recommend that if you can't get vaccinated because of an allergy to the mRNA, sorry if I've got that mixed up, but if you are allergic, that you should see an allergist or a specialist. I don't know if that's even reasonable in terms of timing, but it's something to consider. And obviously ask for the time limit or duration on an exemption. So handouts 3A and B that you'll get tomorrow, those are information published by the ministry on COVID-19 medical exemptions. You've got to refer to the science on those when you are formulating your questions, the most up-to-date science. Religious exemptions. Directive 6 doesn't have it, but the HRTO says you have to consider it. So I've put it in. I can tell you I have not seen any religious exemptions approved as of yet. I don't know any religions that are against vaccinations or testing or anything like that, but I still cover it off. So this is what it's in the policy people will need. If you are claiming a religious exemption, you need a written statement explaining why the exemption request is based on your religion or creed. You must provide background on the religious belief or creed and connect the religious belief to the reasons for your exemption. Supporting documentation published by religious leaders would be of assistance if available. And I specifically state, personal philosophical objections to vaccinations are not considered sufficient justification for granting an exemption. Okay. So just to keep in mind, because you're wondering what if their exemption requests are denied. So remember, if they are denied under this policy, then they are unvaccinated, they don't get accommodated, and they have to test. But there's no accommodation. That's the thing. An exemption, you have to look at whether or not there should be accommodations. We're going to talk about that. So just because somebody asks for a medical or religious exemption doesn't mean they get it. You, as the executive director, if you're the general manager or whatever the title is, you get to decide based on the law, you probably want some legal advice, whether or not this qualifies as an exemption. And I just put in my policy, we're going to comply with the Ontario Human Rights Code with respect to the process and the decision regarding medical or religious exemptions. So the process is really important. Even if you don't believe it, you think it's crock, still go through the process, treat it with respect, treat the denial. This is not, give a reason for why you're not accepting it. So, So yeah, just don't dismiss it out of hand. That never gets anywhere. Just show respect for the process, which is to look at what they've asked for, gather information, and make a decision based on the law of whether or not this fits the exemption definitions under the Human Rights Code. If you do find that somebody has an exemption, that doesn't mean they don't, that they get to do whatever they want. They can still get tested. There should be no exemption against getting tested. But you might have to decide whether or not you need to accommodate the exemption. And that's going to depend on accommodation means, what do we do with this person? Can they work on site? Do I have to have them work at home? Do I have them use full PPE? So it's really, what are you going to do now that they have the exemption? Because really in the directive number 6, even if you get the exemption, you still have to test. So they probably, and they might have to wear full PPE. So there might not be a lot to the exemption, even if they get it. But if you are looking at, working from home, etc., they might say, this is where an accommodation might come in. They might say, I can't get vaccinated for a medical reason. And you might look at it and say, yes, you're right, you can't get vaccinated. And they might say, therefore, I have to work from home. Then you have to look at that accommodation request. And whether or not you have to accommodate, based always on the facts. It's always an individual assessment. That's what the law says. You must look at this individually. So you have to look at the type of job duties they have. Is it possible for them to work from home? Or if I have them work in the office, what precautions can I put in place? It's important to look at all the facts, engage in a discussion, get their input. You don't have to agree with it, but you can offer the opportunity to give input. You can respect it, and you can disagree, but it can be done respectfully. And then you determine whether or not you can accommodate and what happens next. If the person can't come to work because they're not vaccinated, like they're saying, I can't come to work, and you have nothing for them at home, you don't have to give people paid leave to do nothing. So if they're asking to stay home and you have no work for them, they might have to stay home on an unpaid leave of absence. Really, really fact specific. I know some of you are going to have some questions on this, so we'll leave those to the end. Okay. New hires. So we're moving on from human rights exemptions. New hires. In my policy, I've said new hires will be required to present a medical certificate verifying the date they received the vaccine, 2 doses, prior to commencing employment. Yes, you can do this. Yes, you can add it to employment contracts. But you probably want to do it in the postings, or at least in the interview stage. Don't go all the way to a contract, do all that work, and then tell them you have to be vaccinated. And they say, oh, no, I'm not doing it. You just wasted your time. It's still subject to a human rights exemption. So if the person says, oh, I can't be vaccinated, I really want this job, but I can't be vaccinated because of a medical reason, you have to look at it if they have the exemption. If it's a true exemption, get medical information. You have to look at whether or not you can accommodate. So it might be that you say, I can't. Look, your job requires some, hands-on, very invasive procedures, and we are just not taking a chance with somebody who's not vaccinated. You might get a human rights complaint. You want legal advice on that. Just absolutely say no. If you can accommodate, you should, if that's the hire. So if you get a situation where a new hire says, I have a medical exemption and it is legitimate, before you say no to that person, you probably want to get some legal advice on that to avoid a human rights complaint. Okay, so we're into the policy. Now we're going to the options. The options are, 1, you submit proof of a COVID vaccination, either A, that you've already had your 2 doses of the COVID-19 vaccination, or 2, you've got your first dose by, give a date. So if you were to drop this policy today, you probably want to give someone some leeway, right? So they got to have it by next week or by September 18th or something to get the 1 dose, and then they have to get proof of a 2nd dose within 1 month of that. Again, this is not the law. This is just a sample policy that you could have. So staff, here's your first option. Get vaccinated. Show me proof of 2 vaccinations, either now or by whatever date. Option 2, you submit a written request to for a medical or religious exemption. We've just gone through all those. Or 3, you can do an educational training session. I've included a link to one here, the University of Toronto educational session. I think there are others. I think Sunnybrook might have one. This is just one I know of. I do say that if you're choosing this option, that the time spent in completing the educational option, it's done on your own time. You can use training time if it's available, but if you don't, then it's on your own time and it's unpaid. I think that's reasonable. Remember, you can just drop this as an option and just offer the educational program as a resource. So you could just have you're vaccinated or you get an exemption. In the policy, and I've said that they have to complete a vaccine option acknowledgement form where they will choose one of the options that is provided to you as a handout, a draft acknowledgement form. This is where you would collect their disclosure on whether or not they are vaccinated or whether they got 1 or 2 doses or they're asking for a medical exemption. I say here, I get a lot of questions, well, what if they refuse to give it? What if people refuse to fill out the form or refuse to tell me? Then I just treat them as though they're unvaccinated. Gets rid of that conflict. I'm not going to fight you over it. You're either vaccinated or you're not. Don't fill in the form, you're unvaccinated. That's how I would handle that. We have a statement in here about the collection of vaccine information. That it will be kept confidential. It will be kept in the staff's personal file, and you will not share it with other staff, physicians, or patients without your consent. You can, the organization can use cumulative numbers. Hey, we're at 98% and share that, but I can't specifically say whether you're vaccinated or not. Now, if I've got unvaccinated people going around in full PPE and others are not, people might figure it out. That's okay. I'm not concerned about that. It's just like if somebody gets an accommodation because they can't lift something or they can only work half days. People might figure out it's due to some type of medical issue. I can't prevent people from connecting the dots, but I am not going to share it. I put in our policy, the best scenarios that we announce to our patients and staff that 100% of our eligible staff are fully vaccinated. Some privacy considerations, because as I said, you are not prevented from collecting this. And just like you're not prevented from collecting medical notes. Mary was sick, was absent from work due to sickness. But treat it like any other medical information. I generally think you should put medical information in a separate, if you have a file folder or a separate folder on the system, it should be in a separate file folder marked confidential, and access, if you can, should be restricted to those who really need to know, not to just anybody who happens to go into the file. Again, you don't want to provide it to anybody else without the employee's consent. You can make health and safety decisions based on it, but you shouldn't disclose it where it's not necessary. Okay, so this is a vaccinate or test policy. If you are unvaccinated, whether you don't want to or you've got an exemption under the human rights, you have to test. You have to submit to the antigen point of care testing, which is the rapid testing. And I believe the results are ready in 15 minutes. You must have a negative result before you come to work. The number of times you want to do testing is up to you. Directive 6 is saying once. I've given you a handout on from the Ministry of Health on testing in the workplace, or testing, and it indicates how much you should test during certain phases. And I think right now the recommendation is 1 to 3 times a week. So you can do that. If the staff has a positive test, they have to follow up and stay at home until they get a PCR test. And if they have to take time off because of a negative rapid test or any other, if they get a positive PCR test, they can use any accumulated accrued paid time off, or the paid idle days. Remember, there's 3 paid idle days for COVID-related reasons under the Employment Standards Act. They can take those. But if you don't have any paid time off, or you've used all your idle days, the time off is unpaid. Okay. And the last part just says, we will, oh, sorry, I've got to, a refusal to submit to, yes, so a refusal to submit to testing, the employee will be placed on an unpaid leave of absence until testing is taken. So if an employee says, I'm not doing it, and I've had employees say that, they quoted the Geneva Convention and Consent to Treatment Act, and you're not forcing somebody to be tested. Never going to hold somebody down and get tested. But if you don't, you can't come to work. That's the consequences. And if you continue to refuse, termination of employment may occur. I think that would be upheld in a court. I can't guarantee it because I haven't seen any cases. But testing is recognized. There's by arbitration decisions. I've listed 2 in here. We won't have time to go through them, but there have been 2 arbitration decisions where a unionized employer implemented testing, and the union challenged it at arbitration and said, it's not 100% effective and it's invasive. And both arbitrators said, no, we're in a pandemic. You work in healthcare. This is reasonable in the circumstances. You might want to have a look at those cases, because one of the arbitrators did say the testing was done with dignity. People were behind a closed sheet. Nobody could see what was being done. So you can just have a look at those for the process. But so far, the case law is saying testing is A-okay. So I think if an employee were to refuse, that they'd be in big trouble. If you were to terminate and they contested it, I think a court would have a hard time siding with the employee. Now, before you terminate it, you want to sit with the employee and say, really, what's your concern? Why is this bothering you? Look, the law is on our side. We're doing this for your safety, everyone's safety. Please reconsider. If they didn't, then I would probably give them a written warning saying, if you don't reconsider this by next week or whatever, then your employment would be terminated. We don't want to see this happen. So don't be heavy-handed. Always be fair, but I think you can be strict on this. Okay, so yes, here's some legal support for testing. 2 cases. You can go through those when you have some time. Okay, who pays for testing? Big question. Right now, I believe the testing is the kits are still being provided for free. I've given you a link to the Ontario site to get free rapid tests. I don't know how long that's going to last. The resources are going to last. In my view, I think if somebody voluntarily says, I'm not getting tested, not a medical exemption, excuse me, I think they should have to pay for it. My personal view. I think that would be, I think a court would agree with that. I think that's reasonable. If it's a medical exemption, you might want to pay for it. You're not going to get that many medical exemptions, right? So I don't think that's a huge concern. I've given you some handouts you're going to get tomorrow. That's the August 25th MOH considerations for the point of care testing. It's in this document. It tells you how many times you should be testing during different phases. I saw another document, the COVID-19 provincial testing guidance update. Might be some useful information for you in there. Okay. So that's on testing. Now, the other thing that may happen for people who don't get vaccinated is that they may have to adhere to more stringent IPAC measures. So everyone still, regardless of if you're vaccinated or not, we all still have to mask or wash our hands and physical distance, whatever your rules are. But for unvaccinated staff, whether it's a medical exemption or it's my personal choice, you may have to, different rules may apply to you. You may not be able to eat in the lunchroom when we eat there because we're going to unmask and we don't want you there if you're unvaccinated. You may have to wear full PPE. If the masking requirement is no longer in place, you may have to continue to mask. So this doesn't set out what IPAC rules are. That's up for you as an organization. But it does say, be aware that if you're unvaccinated, special PPE or IPAC rules may apply to you. This is a resource I've provided to you. Again, these long titles, but this is from the Ministry of Health, and it's the Provincial Infectious Disease Advisory Committee. Interim guidance on IPAC for healthcare providers and patients vaccinated against COVID-19 in hospitals and long-term care homes. Ugh. So basically, it's a document for hospitals and long-term care homes. I still think it applies to primary care. It is basically, here's the different IPAC controls you can have for staff if they're vaccinated versus non-vaccinated, or patients who are vaccinated versus non-vaccinated. It's July 2021. I tried to see if it was updated. I couldn't find any update. So, but I think it's somewhat helpful. So it says vaccinated and non-vaccinated healthcare practitioners can be treated differently based on vaccination for the following purposes. Routine testing is not necessary for vaccinated healthcare workers. Fully vaccinated healthcare workers don't require eye protection where patients are within 2 meters and are masked, unless you're in an outbreak. Fully vaccinated HCPs with high-risk exposures are no longer required to self-isolate. That should say asymptomatic HCPs. That's a big typo, asymptomatic. But if you're vaccinated and there's a high-risk exposure, you don't have to isolate, according to this document. And vaccination status may be considered regarding placement of workers during an outbreak of COVID. So those are just some of the different IPAC controls under this guidance document. I've also placed in my policy that, that health and safety protocols may impact unvaccinated staff's working conditions, job assignment, duties, workspace location, weekly hours, position, etc. So if you're unvaccinated, even with a medical exemption, there may be situations where I can't accommodate, if you have an exemption or won't, if it's a health and safety risk. You know, if you are seeing older patients who are immunocompromised, and it's a very close one-on-one, I may have to put you to different duties, or I may have to cut your hours and have somebody else do it. Again, it doesn't say what you're going to do, because everything depends on the facts of your situation. But it says, I have the right to make changes to your job because of your vaccination status, up to and including a leave of absence without pay. I say in the policy that the ED or general manager We'll work with staff to reduce the impact of health and safety protocols on your working conditions, but health and safety is going to be a primary consideration. So the message is there. I'm not going to punish you because you're not vaccinated. I'm going to put my personal feelings about whether you should be vaccinated or not aside. That's not what's at play here. I have to be mostly worried about health and safety, and that may impact your job. I'm going to try to be fair with you about that, but at the end of the day, I may have no other choice but to change your working conditions if it is for the health and safety reasons that impact my staff or patients. So here are just some other IPAC differences that you might consider. More stringent PPE requirements, you might do the gown, etc. They might be moved to a different role. Work hours might be staggered. You might have different common areas for staff, more physical distancing requirements. They may have to work remotely. They may be off work without pay at any time or during an outbreak. And there may be many, many more. Just some examples. I also put in the policy. There is no guarantee, I don't say no guarantee as a heading, but I do say the organization will comply with all provincial and regional public health requirements to reduce the risk of COVID-19 exposure. However, due to the nature of the virus, despite taking all reasonable precautions, we cannot guarantee zero risk of exposure to COVID-19 while on the organization's premises. So one of the questions you had is there a chance you can be sued if staff are not vaccinated? You allow them to come to work and somebody catches COVID at work. Yes, there's always a chance you could be vaccinated. But right now, there is no law saying you must have everybody vaccinated at work. In fact, most of the PHUs are saying vaccinate or test, which says people can come to work if they're tested. So the law, you are not breaking any laws by not requiring everyone to be vaccinated. By allowing people to come on who are tested, you are not breaking any laws. So I think a court would take that into consideration as long as you've done all the other reasonable IPAC controls and public health recommendations regarding infection control. So I think there is a chance, but I think a court is going to understand that employers, you're between a rock and a hard place. If you introduce mandatory vaccinations, you can be sued. If you don't introduce them and someone gets sick, you can be sued. Courts are generally reasonable. And if you've done everything reasonable and in line with the law, which this policy is, then you should be okay. Is there a chance you can be sued if somebody gets the vaccine because of your policy and has a serious reaction? Yes, there is a chance you can be sued. But again, I think the risk is low. These vaccines have been approved by the World Health Organization, by Health Canada. Your governments, your leaders every day are saying, go out and get vaccinated. So I think it would, unless there were some unusual situations, it would be difficult for somebody to sue you because they had an adverse reaction to a vaccine. Final sections of the policy. This is the end of this policy, just that it's been developed and approved by the board, and the executive director has been granted the authority, to enforce the policy. That's for those of you who have boards out there. And if you're the executive director, general manager, you don't want to be the one, you don't want to be blamed for this policy. You want to say, look, this is full support of the board or the physicians or the owners or whatever. I have authority. I'm just implementing the policy that's been approved by the organization. And duration and review. COVID, everything changes. Goodness knows when we get off this webinar, there could be new information out that affects what I've just said. So you want to make sure this can be changed at any time without notice because you have to comply with new laws coming in. So that is that is the vaccinate or test policy. Now, for mandatory vaccination policies, so some of you out there who decide, no, I'm going to have vaccinate or terminate. Stricter policies. I'm not doing this testing shenanigans. If that's where you want to go, I've given you a handout, a policy that I've drafted that you could use. I told you there might be legal challenges to some of the repercussions, such as termination, etc. But here's a policy you can use. I tried to download this, but I couldn't. But it's City of Toronto has one as well. Here's a site for it that you might want to use. Okay, those are sample mandatory vaccinate or terminate policies. Okay, so a couple of questions you had. If an unvaccinated staff person gets COVID, do we have to pay them if they are not working? Can they take personal days and vacation days? Yes, they can. They are also entitled to the maximum of 3 paid idle days or COVID days under the ESA. Main message is treat them just as you would any other illness. Don't punish them because they did not get vaccinated. Then you might have a possible human rights violation. Even if they didn't have a medical exemption for getting vaccinated, once they're sick, they are protected under the Human Rights Code. Don't punish them. Treat them as if they had any other illness. A bottom line to avoid lawsuits. Again, just because someone is unvaccinated doesn't mean you can be unreasonable. If you want to avoid a lawsuit, treat them with respect, even if they submit the most ridiculous letter, which I have seen the most ridiculous letters as to why they're not getting vaccinated, citing a law that was so wrong. It was just, you still treat them with respect, okay? Try to communicate with them to get to, is there anything you can do to change their mind, to put their mind at ease? If you can't, then you make a decision. Be reasonable in your decision making. If you need to consult with somebody to get an objective opinion, do so. When you make a decision, be able to defend it. Picture yourself in front of a court or a tribunal, and the judge says, "Why did you do that?" Picture it. Be able to say, "I did it because of this." And it shouldn't be, "I did it because they got on my last nerve and I just was fed up." No. It should be, "I did this because I had to balance everyone's interests, and based on health and safety, this is what I thought was the best way to go." And communicate that decision-making process to the employee. If you have to impose a harsh rule, even if it is termination or leave without pay or reduction in hours, send them a friendly email explaining your decision, the discussions that you had, and why you're deciding the way you are. That is one way just to avoid getting into a legal dispute about this. You've got enough on your plate. Okay. Question, do I have to report a COVID-19 case from work to WSIB? Yes, but only if all 3 of these occur. You are registered with WSIB. If you're not registered with WSIB, don't report it. 2, the employee tests positive for COVID-19, and the employee states or you have reason to believe they contracted the virus at work. Even if you don't agree, if they said, "I got this at work," and you don't agree, you should still report it. It's up to WSIB to make that call. And here's a link to some FAQs from WSIB on this. Do you have to report COVID-19 cases to the Ministry of Labor under the Occupational Health and Safety Act? This applies to all employers. Yes, if somebody has contracted COVID-19 and they contracted it at work. Again, if you're not sure, it's probably best to be safe. Okay, cognizant of the time here. Can a healthcare worker refuse to treat an unvaccinated patient? Now, I am basing this on a handout from the OMA. It was the Directive to Family Physicians. It is a couple of months old. I have been given authorization to share this handout, and it is a good source of information for you to read through. But basically, the message is, and I agree with this. Before I get there, caveat: I'm an employment lawyer, so when we get into patient healthcare issues, I feel like I'm stepping a little bit outside my area of expertise. So I'm sharing information. But remember, I'm an employment lawyer, not a physician or nurse practitioner or healthcare worker. The basic message is, don't deny healthcare to an unvaccinated patient. Treat them like they are an asymptomatic COVID-19 carrier. Whatever PPE and IPAC controls you have for a COVID carrier, asymptomatic, treat them the same way. Can you ask a patient to confirm their vaccination status? Yes, you can ask. If they give it to you, it's PHI. But if they refuse, just like the staff who refuses, treat them as if they are unvaccinated equals treat them like they're an asymptomatic COVID-19 carrier. You don't have to get into a fight. Just say, okay, I'll take you're not vaccinated. Can you do virtual visits for unvaccinated patients? I think you can. We're reasonable, but we're not reasonable. I don't think you should. Not always. One of the suggestions in the handout, I believe it was the handout or somewhere else I read, was if you have unvaccinated patients, you might consider relegating them to specific days or hours. So only unvaccinated patients are going to be treated between 3 and 5, or Thursdays and Fridays, I don't know. The rationale given for that suggestion was it's a more efficient use of PPE, because all your patients have to be treated, as asymptomatic COVID-19 carriers. And you can reinstitute the maximum social distancing rules because everybody is treated, as everyone is unvaccinated. And you might also want to consider what your specific college has to say if you're dealing with social workers, nurses, etc. Are healthcare workers legally required to tell a patient if they are vaccinated? No, there is no legal requirement to disclose. A patient can ask, but you don't have to disclose, and you shouldn't disclose if the healthcare worker has not given you consent. You can advise the patient you are taking all reasonable care to protect the patient, you're complying with all public health unit recommendations. Just as a point of interest, when I last looked at this, the Royal College of Dental Surgeons were advising dentists and staff, do not disclose. The OMA was encouraging physicians to be transparent. I just thought it was an interesting difference of approach. But legally, you do not have to tell patients if you're vaccinated. Okay, so that brings us to the end of the presentation. I only went this far because I wasn't sure how far or how long it would take me to get there. So we do have 15 minutes. Bryn, do you want to? Yeah.
Hi, well done, Maria. You covered a lot. We're just digesting it all. Take a drink of water if you need to. We do have some questions coming through on the chat and in the questions pane. You've actually even covered a majority of those too throughout the course of your presentation. But a few that I don't think we're able to get to that I'll ask you now. A couple around clinics that are based on hospital premises. Do they have to adopt the hospital policies, even if it's above and beyond Directive 6 and they're mandating? What is the advice for any clinics that are based on hospital premises?
Oh, interesting. I think so. What you're saying is if the hospital has gone to mandatory vaccinations?
Yes.
Instead of vaccinate and test, do I have to adopt that?
Yes.
I know. Okay. I don't think Directive 6, I'd have to take a closer look at Directive 6, but I don't think that's what Directive 6 is telling you. But I think the issue is between you and the hospital, right? So I think you got to talk to your hospital. Are they requiring you to, are they saying, look, if you want to work on our premises, everybody's got to be vaccinated? That's a different issue. That's a negotiation that you have to look at your terms of your lease. So again, I don't think it's Directive 6 telling you to do that. That's between you and the hospital.
Okay, so that might be approached individually between the clinics and the hospital. Similarly, there's other clinics where their staff work on hospital sites again, so it might come down to them discussing these with their hospital specifically.
Yeah, I mean, if you've got staff working on a hospital site, you probably have some type of secondment agreement or some type of agreement saying you will abide by hospital policies if you're working on a site. So you'd have to look at that kind of documentation.
Okay.
To see what the responsibilities are.
And then when it comes to the point of care testing, which you talked quite a bit about, there is a question here whether the testing has to be done in clinic. Can it be done at home? Does it have to be done in the pharmacy? Is there flexibility in terms of where the test gets done?
There's definitely flexibility. I don't even think Directive number 6 deals with where it has to be done. I'm not going to advise you on how it should be done. There's a lot of guidelines out there, but I'm pretty sure I know some clinics that are doing it at home, etc. So I think that there's flexibility in what you think is the best way to do it.
Okay. There's just a comment here that for Glenn that I think that anyone who suffers any legitimate injury as a result of receiving a COVID vaccine, so someone had to get the vaccine as a result of the policy, could be eligible for the vaccine injury support program versus targeting the employer. So just a comment there that I thought was useful.
Yes, that's a federal program, and thank you for raising that.
Okay. Just going through here because now more is coming in. It's hard to follow. If the testing is done on site by an employee nurse, how should the result be reported?
In terms of I haven't thought it, in terms of if you get a negative or a positive?
Yeah, negative or positive.
I'm going to leave that to the professionals. Like, I think in terms of best practice, that is,
yeah. Someone added here that they're going to have their staff complete at home and then upload a picture via their screening app prior to start of the shift. So again, if people have comments on these questions, because again, it's not always black and white, share them in the comments, but that's a good suggestion.
Yeah, but if you're doing at work, I mean, I'd have to think through the operation part of it. If you're doing it on site, you get a 15, the person, I think it takes 15 minutes.
Yeah.
So they're probably not going to go anywhere for 15 minutes. And then you report whether or not they have if they have a negative test, they can probably go on to work. If they have a positive test, I would think that you would report it to the executive. There would be one person who you'd report it to, and that person would then take over to decide what happens next. That's how I would see it working out.
Yeah, another comment here that people are going to require them to complete it in a pharmacy just to make sure it's done accurately. So again, not a right or wrong approach, but definitely different approaches being taken. Another question here, just regard to the medical exemption questionnaire, a question whether or not there is a template available. So I know you spoke about completing if people do have medical exemption, the questionnaire that the employer was to give the employee. Is there samples or templates or any consistent way to complete that questionnaire?
I don't have one for the simple fact nobody's asked. I haven't had this request yet, believe it or not. Nobody's asked for a medical exemption for a vaccine yet. It's all been, I'm not vaccinating. So I haven't drafted one, and I'd have to know how far before I would draft one. There was a slide there. I put out the different options, right? That you can ask for. I just want your objective opinion. Can this person be vaccinated? Or I want the reason. Or is it for one of these reasons? I'd really want to know what that employer, how far they wanted to go to draft before I draft the the medical questionnaire. It's like this, people say to me, can you give me a policy? No, you tell me what you want to do, then I can draft a policy.
Yeah, and I will encourage people, as you develop templates, share them with your associations, and that's a good way for us to get out samples out there as well. Just a comment here, and I think people are just looking for clarity. Can you confirm that we're allowed to ask clients and patients upon arrival to our site if they are vaccinated or not? And an extension of that question is, can they ask patients specifically for the vaccination status prior to allowing them to participate in group programs?
I believe you can. I believe you can ask. And if they refuse, then you treat them as unvaccinated. And so you have to ask yourself before, what am I doing if they're unvaccinated?
And then different type
right?
Of
and so that goes back to, I'm not refusing care to unvaccinated people. So you have to think past the can I ask. You're going to have to ask yourself, what am I going to do with that information? And what am I going to do with the people who are not vaccinated?
Beth and Kavita, I'm just trying to go through all the questions here as well. It's hard when people put them in chat because it's hard to follow. So it is a lot easier if you put them in the Q&A panel, just of note for folks. There was a comment here that given the fact that vaccinated and unvaccinated staff are just as likely to spread COVID, how come, or how do we respond to questions about testing everybody? So if we're equal as likely to spread COVID, how come everyone is not getting tested?
Do we know this for sure?
I think there's recent, yeah, I think there's recent evidence out there regarding transmission and spread amongst vaccinated versus unvaccinated. So
okay, so that's a good point. But when I consider that 95% of the people, okay, and this is where I'm getting out of, I still think testing right now, the law is that you can do it. I'm thinking most people who get COVID right now are unvaccinated. And if you have COVID, if you're more likely to spread it, I would think. But until the law changes, until directive number 6, like to me, that's your legal peg. So if there's arguments out there about people can, the rate of transmission is the same, you say, yeah, tell it to the Chief Medical Officer of Health of Ontario. And when she says that testing is not recommended, I'll follow. That's what I would do. I mean, right now you've got every public health unit out there saying test at a minimum. And you got some saying that's not enough. So I would follow their lead. I'm not going to interpret the science. I'm going to follow the lead of the public health units of Ontario, and that's what they're saying.
Yeah, good feedback. Just back to being on hospital sites, and I know this wasn't black and white and might be needed to be discussed with each individual clinic in their hospital, but someone here is saying that they're on a hospital site, the hospital put in place mandatory COVID vaccination policy, and they're saying that they'll terminate their lease if they do not follow the hospital directive. Can they do that using Directive 6 as their reasoning for expecting that?
I think they can use that as an argument, but now I'm assuming that they're doing not a vaccinate and test policy. The hospital is doing vaccinate or terminate. If it's vaccinate or test, they can definitely use Directive 6. If it's vaccinate or terminate, then they're probably going to have to rely on their lease agreement and the terms and conditions of that. But it's I'd have to know more facts.
And then I think you answered this, but I'm gonna ask it. What if an employee takes the fifth, which I think is an American term, but I think we have something similar in our charter in Canada here, but takes the fifth and refuses to answer their vaccination status based on the grounds that they'll face backlash from other employees?
Then you treat them as unvaccinated. That's right. So you assure them, I mean, in that case, that this information is not to be disclosed to anybody else. We just need to know it to implement health and safety precautions here. and if you don't disclose, then you're just treated as unvaccinated. And whatever that treatment might be, you have to test.
Okay. Yep. And a couple more here before we wrap up. If we have a strong employment contract drafted by Maria that has a good termination clause and does not allow for common law, are we in a better position to move forward with vaccinate or terminate and therefore only needing to pay ESA minimum?
Absolutely. Yes. The main consideration, if you're going to terminate, if you're going to consider termination, the first thing I'm going to ask you, let me see your contract. And if your contract's a good contract that limits you to ESA, then as opposed to common law, which is much more expensive, then at least you know, okay, my risk is, they've been here 4 years, I have to pay 4 weeks. So definitely a good contract limits your liability. It's like, yeah, I'll take this on to pay her 4 weeks, right?
Yeah.
Because that'll be the end of the story, unless if she doesn't have a medical exemption. That's the end of the story. So good contracts always save you.
Good point. Question here about boosters. I'm not sure if I'm clear on the question, but it says, what about boosters? I assume staff will not be vaccinated once boosters come into effect, even with 2 doses.
I'm not sure I understand the question.
Me neither. So maybe I don't know. Let me just see who wrote that one.
We're not required to get the boosters right now. I think we're only at the stage right now. We're looking at who should get the boosters, and it's like the most vulnerable right now.
Yeah, I think that's probably too early of a question to ask, but Marina, who entered that question, if you have anything else specific, we can follow up with you afterwards regarding that. But I think
it may come down that boosters are going to be a requirement too, and we're going to be meeting here in 6 months about a booster vaccination policy. Yeah. But right now it's not on the.
Yeah. A question specifically from a family health team here. Are they required to keep information on their affiliated physicians and the affiliated physician staff as well? Or is that up to the docs to collect?
So that's interesting. I don't know. You're not obligated because you're not entitled to that information really if the docs don't give it to you. So you can't be obligated to do something that you're not entitled. You can't go around and ask the docs, secretaries and nurses, et cetera, are you vaccinated? That's not, unless the docs consent. So I don't think you're obligated, but I think from a reasonable, your obligation under the Occupational Health and Safety Act is to take all reasonable precautions to protect the health and safety of your employees. So I definitely think that's a very good point. You want to have a conversation with the physicians, and you want a meeting of the minds, right? In terms of your policy. And if you don't have a meeting of the minds, then I think you have to consider that all their staff is unvaccinated. And what am I going to do to protect my staff?
Mm-hmm. Yeah, that's good. A good question and a good answer for all teams then to be considering and speaking with their affiliated physician groupings to come up with some sort of agreement on approach. Another question here, just in terms of paying. So you said it was reasonable to ask non-vaccinated staff to pay for their antigen tests. Could that go even a step further and ask them to pay for additional PPE that they might be required to wear since they are not vaccinated?
That's oh gosh, you give an inch, they tell.
I know.
When I say I think it's reasonable, I could be like somebody else could disagree with me, right?
Yeah.
Meaning a court, etc. So I think it could be reasonable. I'd really want to look at the situation to see whether or not that's the best way to go. I'd want to have a talk about the facts. But yeah, if it's just one out of everyone, you might say that this is something I want to do. If it's negligible, I'd be thinking, do I want this fight? Do I really want this? I gotta know. And I'd say, well, let me see her employment contract. Oh, she's been there 1 year and you only got to pay her 1 week. Who cares if it's reasonable, right? If she fights it, you just pay her out the 1 week, right? Versus she's been there 15 years and everyone loves her. And if she walks, you may have to pay a lot more. So,
okay.
Yeah.
I know it's 1:30, so I'm just going to get through the last couple here. Should we maintain the COVID vaccination policy separate from their other vaccine policies, such as influenza?
I would. Yeah, I've seen some try to combine them, and it's not. And plus, COVID, it changes all the time, right? So definitely change it. Keep it separate.
Okay. And then just the testing results, should it be sent to a designated person at work? So to the nurse, to the HR, to the supervisor. This is coming from an HR person that says they haven't disclosed to the supervisors yet the status of the team's vaccination or not. So it just should be one point person, I'm assuming?
Yeah, I think one person should be in charge of collecting it and storing the information, but it can be shared with decision makers. So I think the HR person can tell the executive director, for example, here's our list of vaccinated versus unvaccinated people.
Okay.
Like people who make decisions, you should be able, I don't think there's anything preventing you from knowing, but I do think this one person should be collecting it in charge of it.
Okay. And just one last question here, because it came up a couple of times, just a clarification for Directive 6. There's mention of providing proof of vaccine or presenting exemption or attending an education session. Is that correct? The or regarding the education. So if they're not vaccinated, they simply provide proof of attending an education session.
Yes, but remember,
yeah.
Directive 6 says you can drop the third choice of the educational requirement. So Directive 6 really gives you an option. I can have 3 options: vaccinate, exemption, or education. Or I can have 2 options: vaccinate or exemption. And if I do that, you do have to give people the opportunity or the resource, but it's not an option. So you are correct, but you can drop the educational section.
Okay.
And the same in the policy that I've given you. I put in the educational, but you can drop that.
Great.
And just say vaccinate or exemption.
Okay. It is 1:32, so I'm going to thanks Maria for her time today. This has been absolutely invaluable, a wealth of information. I think it's probably a lot for people to digest. So we will have the recording available hopefully within the next 24 hours or so. You may need to listen to it a couple of times because Maria did a great job covering so many questions that were sent in. I know we spoke of a variety of handouts today as well. So just a reminder that the handouts will also be sent with recording in the next 24 hours or so. So again, just keep your eye out for that. It'll be sent to everyone that was registered today and also any other senior members that this would be pertinent to. Again, that's up to each association in terms of their communication channels. So thanks to everyone for joining us today. Any outstanding questions, we have tracked them all today, so we'll do a double check too that we got through them. And if there's anything outstanding, we'll send that in the follow-up email as well. So thanks to everyone for joining. Huge thanks to Maria. Glad we could do this with our partners today and hope everyone found it helpful. If you have any further follow-up questions, please contact your associations and they can send them in to us and we can pass them along to Maria to get answered at a later time. Thanks, everyone.
Okay, take care. Bye-bye.